Immune thrombocytopenic purpura, or ITP for short, is a disease caused by the immune system mistakenly attacking its own platelets. In this mnemonic video, we'll cover all of the important facts about ITP so that you'll be ready on test day. In today's day and age, it seems as if everyone is plagued with computer issues. That's why people like our IT professional here are so crucial. This IT Pro is our symbol for ITP. Get it? IT Pro for ITP? Let's keep exploring our scene to learn more about this disease. Our IT Pro was called over by the boss of a well-established company who was experiencing some technical difficulties. Unfortunately, our IT Pro wasn't able to resolve the issues. Angry and frustrated, the boss lashed out in anger and knocked over his plate of lunch, which shattered all over the floor. This broken plate is our symbol for the destruction of platelets. Get it? Because plates are our recurring symbol for platelets, so the shattered plate should represent the breaking of platelets. ITP occurs when the immune system mistakenly attacks and destroys the body's platelets. That's why the I in ITP stands for immune, because the immune system is the primary culprit. If you've ever seen the TV show Succession, then you'd know the inheritance of control in a big corporation like this is a big deal. That's why our boss was eagerly awaiting his 23andMe genetic test results. However, as soon as he opened the report, the computer froze up and malfunctioned. So from the boss's perspective, it was 23andMe's fault that his computer was broken. That's why he's taking his anger out by punching the 23andMe on his screen. Attacking the 23andMe report is our symbol for antibodies against GP2B3A. You could even say that the boss is now anti-23andMe, just like how these antibodies are anti-GP2B3A. GP2B3A is a glycoprotein that exists naturally on the surface of our platelets, playing a role in the formation of a platelet plug. In patients with ITP, the immune system produces antibodies against this glycoprotein. These antibodies then bind to the body's platelets and mark them for destruction by macrophages in the spleen. The development of ITP is also often a result of other illnesses. Let's cover these clinical associations next. Like any successful executive, this boss has his fair share of enemies. To protect himself, he's trained a ferocious wolf to act as his personal bodyguard. This wolf is our recurring symbol for systemic lupus erythematosus. Get it? Because lupus is the Latin word for wolf. One illness that is associated with ITP is systemic lupus erythematosus, also known as SLE or simply lupus. Lupus is an autoimmune disease caused by the immune system attacking the body itself. This should make sense as both SLE and ITP involve a misbehaving immune system that incorrectly attacks normal parts of the body. The technical issues arose due to a malicious virus that somehow made its way into the boss's computer. You can even see that virus on the screen. Let this computer virus remind you that ITP is also associated with various viral infections, like HIV and the hepatitis C virus. Let's turn our attention back to the plate that was knocked off the table. Originally, it had a delicious, rare, steamed king crab beautifully plated on it. Of course, now the plate is splattered all over the ground. What a waste. Anyways, this crab is our recurring symbol for cancer, because cancer is the zodiac sign represented by a crab. Let this crab remind you that ITP can also happen as a result of cancer such as chronic lymphocytic leukemia. After experiencing all this fame and glory, the boss may have unfortunately found his way into drug use. He keeps his drugs stashed away inside his desk, but you can barely catch a glimpse of some of his drug bottles poking out of the shelves. These drugs are a recurring symbol for drug reactions. Yep, the fourth and final secondary cause of ITP is an adverse drug reaction. Basically, taking certain drugs can stimulate the immune system to produce antibodies attacking platelets. Next, let's cover the primary symptom exhibited by patients with ITP. A stray shard from the shattered plate flew over and cut our poor IT Pro on the arm. That's why he's bleeding from the cut. This bleeding should remind you that patients with ITP primarily present with bleeding. If you remember that platelets mainly function to stop bleeding by forming platelet plugs, this should make sense. Clinically, this presents with bleeding from the skin and mucous membranes of the body. Specific findings include petechiae, purpura, and easy bruising, as well as gingival bleeding from the gums of the mouth. In fact, the bleeding into the skin to cause red-purple blotches is called purpura, which is actually what the P in ITP stands for. Next, let's talk about some lab values that can help you diagnose ITP. Remember that shattered plate on the ground and how it fell off the table? Well, this falling plate is also our symbol for decreased platelets. As we mentioned earlier, ITP is caused by the self-destruction of the body's own platelets by the immune system. As a result, a blood count will reveal decreased platelet counts. This is formally referred to as thrombocytopenia, which is what the T in ITP stands for. Though it's not his fault, our IT pro felt bad for the boss and brought over a giant Care Bear to try and cheer him up. This Care Bear is so big you could even call it a Mega Care Bear. This Mega Care Bear is our symbol for megakaryocytes. Get it? Because Mega Care Bear sounds like megakaryocyte? When the body senses a decreased platelet count, it stimulates the megakaryocytes in the bone marrow to start producing more platelets. As a result, a bone marrow biopsy may detect increased megakaryocyte number and activity, which indicates that the megakaryocytes are compensating for the destruction of platelets caused by ITP. Our IT pro has had enough for today and can't wait until his shift is over so that he can finally get away from this unpleasant boss. While staring intently at his watch, he accidentally got some blood on it. The blood on the watch is our symbol for increased bleeding time. You know, blood on a watch that keeps time for increased bleeding time. Bleeding time is a lab result that measures the function of platelets, assessing the time needed to form a platelet plug. In patients with ITP, the bleeding time is increased due to the decreased platelet count. There physically aren't enough platelets needed to form a platelet plug to stop bleeding. Now that we've covered the methods of diagnosis, let's move on to the treatments for ITP. Along with drugs, it seems that our boss has also started to misuse steroids as well. These steroid syringes should help you remember that one possible treatment for ITP patients is steroids, namely glucocorticosteroids. Steroids suppress the immune system to decrease antibody activity in your body, thereby slowing down the autoimmune destruction of platelets. Next, turn your attention back to that crab on the ground. It came with a small crab pick to get every last bit of crab meat stuck in the shell. If you look closely, you'll see that this crab pick is Y-shaped, kind of like an antibody. Let this Y-shaped crab pick remind you of immunoglobulins, because immunoglobulins, or antibodies, are also Y-shaped. Anyways, ITP patients can also be treated by administering intravenous immunoglobulins, often abbreviated as IVIG. The IVIG basically crowds the bloodstream with other antibodies that distract the macrophages of the spleen so that they stop destroying platelets marked with antibodies. In anticipation of his 23andMe results, the boss dressed up in his fanciest red tuxedo. Little did he know that the long-awaited reveal would be so disastrous. Anyways, this red tux is our recurring symbol for rituximab. A red tux for rituximab? Rituximab is an immunosuppressant drug that works to suppress B cells in our immune system. This reduces the number of autoimmune antibodies produced, thereby treating ITP. Finally, let's turn our attention back to the wolf who was guarding the boss. It's been feeling pretty bored lately, so it's been passing the time by tearing chunks out of the boss's spleen-shaped chair. Tearing chunks out of the spleen-shaped chair is our symbol for splenectomy. You know, since splenectomy involves removing the spleen, just like how this wolf is removing a part of this spleen-shaped chair. The final treatment to remember for ITP patients is a splenectomy. Remember how we mentioned the platelet destruction seen in ITP occurs primarily in the spleen? Well, removing the spleen effectively removes the site of platelet destruction. This will leave patients immunocompromised, however, so this is really seen as a last resort treatment for patients who don't respond to any of the other options. Alright, that's all for this video on ITP. Let's summarize what we've learned here. ITP, short for immune thrombocytopenic purpura, is a disease characterized by the autoimmune destruction of platelets. Specifically, patients with ITP produce antibodies against GP2B3A receptors on the surface of platelets. These antibodies mark the platelets for later destruction in the spleen. This disease is often associated with systemic lupus erythematosus, various viral infections, cancers, and may rarely be seen as a result of taking certain drugs. The primary clinical symptom of ITP is bleeding, especially from the skin and mucous membranes. Laboratory tests revealed decreased platelet counts, increased megakaryocyte activity in the bone marrow, and increased bleeding time. Finally, ITP may be treated using steroids, intravenous immunoglobulins, rituximab, as well as by performing a splenectomy. And now we're actually done with ITP. See you in the next one!